healthcare. Joyce Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-hosts pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in health.
Cough, cold, sore throat, getting you down? Get Fitzroy mentholated cough and cold syrup for the symptomatic relief of cough, cold, catarrh, and sore throats. Fitzroy cough and cold instantly release and can be taken every 2 hours. It is pleasant tasting and competitively priced. Fitzroy cough and cold is manufactured in England. Fitzroy cough and cold, the relief you're looking for.
Distributed by Jolly's Pharmacy Limited.
Oh, and if they play convenience, make a big difference, then you can trust me. I'm not just where you should be. That is JP Mega. The one-stop shopping, no me, nigga. You could be shopping and having fun, shop. If you're not happy, feel so sharp. It's a to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, no me, nigga. You could be shopping and having fun, shop. If I am not alone, it's a to everyone. What a happy place. Oh, what a happy place. But just fix some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongolia where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Good morning, and welcome to another episode of Jolly's Health Vibes, the first Jolly's Health Vibes for 2026. Good morning to you all who are listening to the big station Q95 FM and are tuned in to the program. It is a pleasure, of course, to be on with you. My name is Trudy, and I am back for another year of health information, health discussions with a bit of vibes, a bit of humor, and a bit of energy. That's what we always seek to bring to you on the program from Jolly's Pharmacy. I will be joined in a bit by Leona, but she is still on her way. We're getting started though, because it's a new year and we're ready and energetic to talk to you about all things health. I want to wish a very healthy and happy new year to our listeners, particularly those constant listeners of ours, those who stuck with us through the past years and who are ready and willing to be back on with us this year. A happy and healthy 2026 to you. And of course, to the people who are tuning into the program, maybe you're not regulars, but you're tuned into the program this morning. Happy and healthy new year to you as well. And of course, to all our guests, the people that typically come on and assist us with disseminating the health information that you benefit from. Good morning and happy new year, healthy new year to you too. Last year we had quite a few people come on the program, and this year we hope to do the same. I see some of our social media listeners, the people who always jump on the Facebook page of Q95 FM and on the YouTube channel of Q95 FM. I see you all jumping on. Happy and healthy new year to you. Julie, I see you are on with us. Good morning to you. There's others. Feel free to shout us out and let us know that you are on the program. Leona has joined me here in studio. So let me say good morning to her. Leona, good morning to you.
Good morning to you, Trudy. Happy New Year to all our listeners as well. I know today will be quite an interesting program, so happy to be here.
Yes, and of course, we will continue with our alternating pharmacists. So Leona is on this week, and then Jacinfa hopefully comes on next week, and we go in and out like that. So that's what you can expect this year. That's what we started off with last year, somewhere in the middle of 2025. So that's what we'll be doing. But Leona, a lot of things going on at Jolly's Pharmacy. As per usual, Jolly's Pharmacy starts off the year, ended the year with giving back to customers and starts off the year as well with giving back to customers. And if I may say so myself, gives back to customers throughout the year, every year. So last year there was the big promotion 45 in 45, Jolly's Pharmacy celebrating 45 years of serving Dominica, and a promotion that gave someone an opportunity to win $4,500, so $100 for each year
Indeed.
that Jolly's has been in existence. And the winner of that promotion was announced this week, and it was Mr. Morris Serial. So I want to say congratulations to Morris Serial, who was a Sunday school teacher of mine back in the day when I used to go to Sunday school when I was young, Mr. Serial. Congratulations to you. 45 in 45, $4,500 was yours. Compliments Jolly's Pharmacy. So a big congratulations goes out to Mr. Morris Serial. And the year is starting off as well with giving back to customers. Big promotion going on right now at Jolly's with Smarty Baby Diaper. So if you're a parent and you are buying diapers for your for your baby, Jolly's has this promotion going on from January 5th to February 28th. You can buy any size of Smarty Baby diaper, any size. There is the small, the large, the extra large, any size of Smarty Baby diaper. So you're looking for the brand Smarty Baby diaper, and if you buy any size, you get entered into a draw to win possibly the following prizes. So the first prize is a baby stroller with a detachable car seat. So if you get the first prize and you have a baby, you get that baby stroller right there as the first prize. Second prize, a baby carrier. So you can carry the baby on you, strap the carrier to your person, to your body, and carry your baby. And the third prize is also a baby carrier. So all you have to do, go to any Jolly's Pharmacy location. Of course, King George V Street, Great George Street, Mega in Fokole, and also in Portsmouth, and also certain retailers like Green Supermarket, J&M Enterprises in Maho, and Original Producers in Marigot. Once you purchase a Smarty Baby diaper product, you are entered, you write your name at the back of the receipt, and you get to be in the draw. So the draw date will be March 2nd, and you get a chance to win either a baby stroller with a detachable car seat or a baby carrier. So all of you parents out there, I saw the firstborn baby for 2026, very cute baby boy. I saw that picture on social media. For all of you who are new parents or parents that have to buy diapers, Smarty Baby diaper is on promotion at Jolly's. You get a chance to win multiple different prizes that I have named. So make sure to get into that draw. If you're going to a baby shower, if somebody invites you to a baby shower, my thing is get a gift that is usable, and that the baby will use, and diapers are definitely a good choice. So if you're going to a baby shower, somebody's having a baby in your friend circle and you were invited to a baby shower, get some Smarty Baby diapers and you can enter that draw. Of course, from now, January 5th, well, from 2 days ago, January 5th, it started, and it ends on February 28th, the end of February. So you have 2 months to get yourself some Smarty Baby diapers and to win. I see our social media followers popping up. Hazel Ann, good morning to you. Catherine, always on with us. Good morning to you as well. I definitely am looking forward to having you all for the rest of the show. What we're going to do, we're going to take a quick break. And when we get back, we're kicking off 2026 with letting you know or discussing with you some big pharmacy news, some big health related news from 2025. And let's see what 2026 will bring. We'll be right back after the break.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-hosts pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience will make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. Shop with your daughter, with your son. Shop better to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. Shop better to everyone. What a happy place. Oh, what a happy place. But just stick some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fonbole where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Cough, cold,
Okay.
sore throat, getting you down? Get Fitzroy mentholated cough and cold syrup for the symptomatic relief of cough, colds, catarrh, and sore throats. Fitzroy Cough and Cold instantly release and can be taken every 2 hours. It is pleasant tasting and competitively priced. Fitzroy Cough and Cold is manufactured in England. Fitzroy Cough and Cold, the relief you're looking for.
Distributed by Jolly's Pharmacy Limited.
And we are back with you. As I promised, we are kicking off 2026 with reviewing some of the big pharmacy news. Of course, Jolly's Pharmacy is the brand that's bringing you this program every Wednesday, Health Vibes. And Jolly's Pharmacy is one of the major aspects of business, of course, is pharmacy, pharmaceuticals. And there are a lot of developments in the world of pharmacy, some that may impact you, some that you may be interested in knowing about. A lot is happening. Of course, technology and medical development is happening at a rapid pace. Technological advancement, medical advancement, very rapid pace. And, we get to keep up with some of the breaking news here on Health Vibes. So we're going to play something for you that is breaking news from the pharmacy world, a clip from the United States. We're going to take a listen at what new is coming up or what new is already in place as it relates to pharmaceuticals for 2026. A lot of people, when the year starts, their focus is on weight loss. And this particular development is related to that. So let's take a listen to that and then we'll come back with our feedback.
With Americans focused on getting fit in the new year,
I don't think I have ever had a New Year's resolution that did not involve losing weight.
a groundbreaking new option is set to shift the weight loss landscape, with two pharmaceutical giants both preparing to debut their oral GLP-1 options. The FDA approving Novo Nordisk's once-daily Wegovy pill last week, with the company stating it's now prepared for a full U.S. launch in early January 2026, with manufacturing underway. Its latest clinical trial results finding people who took the highest dose lost about 16.6% of their body weight on average after 64 weeks. All this compared to Eli Lilly's pill that's awaiting FDA approval, where adults lost 27 pounds over 72 weeks. The pill's set to transform an industry with a growing celebrity fan base. From Serena Williams,
I saw my friends using it, I saw a lot of people on it, and I tried it, and it actually worked.
to Oprah Winfrey. In a new interview with People magazine, she shared her experience with GLP-1s, inspired her to release a new book about her weight loss journey, calling the medication a tool to help you manage the messages that are being sent to your brain about overeating. It's booming business, reshaping spending habits on food.
How do you grocery shop and not waste food on this medication?
According to Reuters, analysts project the accessibility of oral medication could capture 20% of the market by 2030.
There's something more acceptable or palatable about taking a pill.
I'm on week 20. I lost 7 pounds.
Florida mom Shanna Perez began her weight loss journey over the summer with weekly Zepbound injections. So far, she's lost more than 40 pounds.
It helps with portion control, and it also cleans up like some mental clarity about surrounding things around food all the time.
She sees the new daily pills as an alternative to weekly injections, but is still skeptical over that daily demand.
That for me is something to consider just with the busy lifestyle of being a mom.
With good health at the top of many New Year's resolutions, experts say the more options, the better.
We're certainly hoping that more market competition will drive down cost eventually.
So Maggie, how do these pills compare overall to those injectables?
Yeah, that's a question that we're getting a lot. So experts say the short answer is injectables are more effective than weight loss pills, but not by much. And then when you look at cost, pills are cheaper. Both Novo Nordisk and Eli Lilly say starter doses for their pills will come in around $149 a month. Compare that to injectables. Eli Lilly's lowest dose of Zepbound is $299 a month. Novo Nordisk is offering a deal until the end of March, for what it's worth, letting patients with prescriptions get the first 2 doses of injectables Ozempic and Wegovy for $199 a month. And then after that, it goes up to $349. So some real savings there. And guys, again, a new option, which experts are really honing in on here.
An option a lot of people are taking these days. Maggie, thanks.
Yeah, it's going to be interesting in a couple of years to see what happens because all the other effects, right? People aren't drinking as much. Other things like sleep apnea go away. So it's just interesting.
But for a culture broadly, it can help. If people are losing weight, right? It could be we're on the way to something good.
Yeah.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning.
And that was taken from NBC's Today Morning News package. And it's breaking news coming out at the end of 2025. The famous GLP-1s now available in pill form instead of injectable. Leona, let us discuss first of all, what are GLP-1s? The lot was given in this news piece about the usage of them and how they're revolutionizing weight loss throughout America. What are GLP-1s and what's our take here in Dominica? Available, not available? What's the deal from Jolly's Pharmacy's perspective?
Okay, so naturally to begin, GLP would be a glucagon-like peptide one. It's actually a type of hormone that your body naturally produces. So it's produced in the gut, and what happens is it's released after you eat. And what it does is it signals your body or your brain, your hypothalamus, to then say, I'm full. You get that satisfied or satiety feeling, right? So essentially, if we try to allot it to the situation at hand, if you have that feeling that you're full, you're probably going to stop eating, right? So you're going to most likely eat less of those macronutrients, less of those cravings. You're gonna have portion control, all of these things that was discussed in the clip. So all of these, naturally, if we're doing less calories, then we're calorie deficient, we're going down, so we're having less fat storage, less weight gain, and hence the reverse that these GLP-1s medications give you that weight loss effect. So
Mhm.
that's the importance of it there. Now you may hear this term when we talk about diabetes as well,
Mhm.
because well, it can be used to treat diabetes because of that same satiety function that it has. And again, an effect of that, which works for both conditions, would be the weight loss. So it's something that has been there, not as long as other medications like metformin, but it has been there. Right now, the big news, or what happened in the end of December, is that the pill form of these medications were approved by the FDA. Well, for one particular manufacturer, and there's another which seems to have better efficacy, so better weight loss results. If we're talking about weight loss for this, that should be hopefully approved soon. So with these medications, what we have here would be the injectable forms, and that is something that we've started bringing in, I would say, in 2025. So essentially, you would have probably heard of the term Ozempic, right? So that is one of these classes of drugs. And the Ozempic, or the generic name, the semaglutide, is one of these GLP-1 medications, and it can be used for weight loss. It can be used to control diabetes, especially beneficial if the person has diabetes and is struggling losing weight. If they are overweight or in the category of obesity, then these medications are quite effective. Naturally, like any medication, they have their own side effect profile, and of course they have the populations that they can be used in and what they can't be used in. For instance, pregnant women, we will stay away from that for that particular medication. And if the person may have some excessive thyroid cancer risk, these types of things, because it has been shown in studies that these medications have caused tumor growth, but in rats, in animals. So there's a lot more to be done to get the full efficacy or safety profile of these meds, but it is indeed a warning for that. So if you have any thyroid cancer risk, or you're dealing with these types of things, then we'll stay away from that. Otherwise, it's pretty beneficial for controlling uncontrolled diabetes, for weight loss, as well as it's somewhat cardioprotective. So if the person does have risk of stroke, or they've had strokes before, or cardiovascular disease, it does improve those margins as well. So it's a pretty great drug that's come on the market. So if you can speak to your doctor about it. If you feel like you fall into one of those categories, you can have a discussion with your doctor about the risks and the benefits and what may be available for you. And of course, we now have Ozempic on a regular basis in the different strengths that it comes in. So that is something that's available at our pharmacies. We've also had to bring in Mounjaro, which is a different type of drug within that class.
Same category.
Right. We've had to bring it in, and these are things that we can get. It's always available, so long as we can get it, so long as we can source it, we can bring it in. The Ozempic is here already, so if you do get a prescription for that, you can get it one time. But if your doctor is discussing the other types with you, then that is something that you can bring into us, and we can look into finding for you. Now, with the injectables, like the news clip said, the benefit of the injectables is that it's a once weekly drug.
Right.
So essentially, if you're a person who forgets, and you don't do too well with daily pills, then this is perfect, because you just do one quick injection, which is pretty easy. The pen is pretty easy to use. You use that, and you do that weekly, and you are covered. Now, for persons naturally in injectable forms, it's gonna be more expensive, and it's new on the market, so it will be a drug that is costly. However, with the advent of the pills coming up, we're hoping that soon we can start to see it maybe in these markets, and it will be, or should be, at a price that is lower than the injectables.
But Leona, I want to ask, of course, from the perspective of pharmaceuticals and injectables, which is what is available now at the pharmacy. You're saying the GLP-1 Ozempic is what's available largely. You also said, well, Mounjaro, you all can bring that in. And if, based on prescriptions, whatever else you can order. But an injectable as compared to a pill, let's talk about compliance or ease of use. Do people shy away from injections or injectables because they are afraid of needles, or they're afraid to take medication in the that route, that direct into the bloodstream route, and maybe are still reluctant to try an injectable. Do you have that experience as it relates to injectable drugs?
Generally with injectables, so not even just for these drugs, but generally with anything that a person has to inject, you might get a bit of resistance. I know some people who will benefit from insulin, and they very much shy away from it because of the idea of having to inject yourself. It may seem scary, but most times with these injectables, they are subcutaneous. So what that means is it's just injected right there, just under that first layer of skin.
It's not like you're trying to
Right. Exactly.
find a vein like when you're taking
No,
a blood
no.
sample, right?
So it doesn't
No.
require any specific big training.
Mhm,
When you
mhm.
just start on them, your nurse, your doctor, your pharmacist, whatever healthcare provider that you go to can show you how to use them. And typically, it's not that you can inject it in such a way that you'd cause damage, because the needle is very, very, very short, very small compared to the needles you would see if you, let's say, had to go to the E&E to draw some blood or whatever you might have to do. So it's worth trying if you're having an issue. If we're talking about chronic diabetes management, or we're talking about weight loss, it's definitely worth getting over the little fear about it.
Mhm.
And the great thing, again, as opposed to, let's say, maybe insulin or other injectables that you do daily, it's just once a week. So for the most part, we get that one prick and we're done for the time being. And it really doesn't. I don't even believe you bleed, for that long afterwards. It's not that you gush. So some people
Afraid
they're
of
afraid of the
blood,
sight of
yeah.
blood.
Mhm.
It's just a little prick. You wipe and you're good to go, and you can
Mhm.
go about the rest of your day.
Mhm. But I definitely think, the news clip about there now being an approved GLP-1 in pill form
Mhm.
will definitely increase usage amongst people because of, I think, a greater comfort level with taking pills, because it's just a route that more people are used to for taking medication. So I think that will revolutionize how people are taking it. Of course, there is a lot still to be learned
Mhm.
about the drugs and the side effects. As you mentioned, of course, clinical research has been done, but results that are published are largely from animal trials, but we still, are getting piece by piece the human side effects and how prominent they are. Different people are different too.
Sure.
So yeah,
Sure.
so if you're on social media, you'll see different reports about the use of the drugs, GLP-1s. Some of them, like Ozempic, I believe the first line, or the diabetes management is what it is
Indeed.
for, but now there are others that are specifically for weight loss. So some people who are not diabetic are getting prescribed some of the others, like the Monjaro or the Tirzepatide. What?
Tirzepatide. That one is the Monjaro.
Tirzepatide.
Yes.
Yeah, okay. Yeah, so I know, so it's an interesting thing. And I know some people may say, but we have that here now in terms of Ozempic, because you hear a lot about it in
Mhm.
American media.
Mhm.
But people may say, but we have that here now. So yes, we do. And Leona has said it's at the pharmacy, available for people who have a prescription. Of course, it's prescription.
For sure, it is
Yes,
prescription.
it's prescription
For
only.
sure, it is prescription. We've had persons come in and ask about it, but your doctor really needs to determine whether or not, one, you have the conditions that it is used for, and two, if it is best for you. Like we say, it's a new drug on the market, so there's a lot of things that needs to be considered. Even when we talk about diabetes, because these drugs can be used for diabetes. When we talk about diabetes, if you are on other medications, so for instance, you're taking insulin, or you're taking glycoside or
Mhm.
glyburide, any of these things, you might be more at risk for hypertension. So in terms of adding on something like the Ozempic, that is something your doctor would have to think critically on and really monitor, because your doses of your other medications may have to alter if we're doing both of them, to see, to ensure that you don't go into hypoglycemia, because hypoglycemia is also a big issue or risk when we talk about persons who have diabetes. So we talk about
Mhm.
high blood sugar as well as low blood sugar. So with the addition of the Ozempic on top of that, we really have to watch the crisis of low blood sugar. with that.
Right. Okay, so that is one thing that broke in the end at the end of 2025 in terms of the pharmaceutical world, the GLP-1s and the continued revolution in their use. So pill form available now in some brands instead of injectable. You know what? In terms of pharmacy, so I believe I am not a pharmacist. But I believe that working in the pharmacy must be extremely interesting because things are changing every day or every so often. And I think that you all have to be on a constant learning curve.
Definitely a constant learning curve. One of our usual objectives for our not just our pharmacists, but our pharmacists and our pharmacy technicians, and even our pharmacy cashiers also, get involved in terms of the learning. We do regular continuing education. So, you get the degree as a pharmacist and you're a pharmacist, but the information changes every day. So something we might have used 5 years ago that was the top line medication for X, Y, and Z is proven not as effective now versus something else. Or maybe there was a lot of side effects associated with this particular drug. And, the companies, the manufacturers created another drug, maybe within the same class, that has less side effects. That is worth, your doctors and your healthcare team exploring, simply because the idea of medication is to aid whatever it is you may be going through, if it's a condition, if it's an effect, whatever it is, with the least possibility of adverse effects, drug interactions, or side effects. So all the time, we are keeping ourselves updated. We are subscribed to different credible sites where we get information not just on what we offer, but on the general pharmacy world as well. So we're well versed in the different things that comes out to give you a better, healthcare outlook.
I see we're getting a call. Let's take this call. Caller, good morning. Caller, good morning.
Hello, morning, Trudy. Morning, Leora.
Good
I just want
morning.
to ask, I wish you all Happy New Year already, and I'm glad you Happy New Year and all the best.
Thank you.
I just want to
Same
ask Leona a question. Do you have any intention of becoming a doctor? I just find, I find she although she knows her, that's my view, she knows her onions, the way she speaks like she's on top of everything, you know. So I'm wondering if, she have an intention of becoming a doctor.
Leona, big question for you at
Indeed,
the
it's a big
first show
question.
of the year. Intentions of becoming a doctor.
It was definitely in the cards for me. I fell in love with that first, and I fell in love with pharmacy after. Jolly's was actually my first official job, and now the medication side of things is so big to me in terms of the interest, and I think it's a big part of medicine itself. But you never know in the future. But right now I'm definitely going ahead with my pharmacy degree.
So and we don't want to pull you away from the pharmacy just yet.
No.
Because of course pharmacists play an important role in medical care and medical, so health practitioner, that term involves more than just the doctor.
It definitely does.
The pharmacists play a very critical role, and of course our nurses, our lab technicians, for diagnostic
Indeed,
tests and so on.
Really, when we talk about pharmacy, the more we get into it, we further in my degree, the more you get into it, the more there is out there, So it may seem, and sometimes it may seem from the outside that we're just, counting, dispensing, bagging, and labeling, but there's so much more that goes into medications as to dosages, your conditions. Each individual is different. What your body, your genetic makeup, what your family history is like. If this particular drug, we could be twins, and this drug could be good for me and not good for you. There's environmental factors, all of these things. There are drug side effects. There are drugs that interact with each other. So learning that part of things, the medicine part of things, is truly dynamic. It truly is.
Let's take another call. Caller, good morning.
Good morning, good morning.
Good
morning.
Happy New Year. That is Jolly number one fan.
Happy New Year to you.
Lily, good morning, my daughter.
Good morning. Good
Good morning.
morning.
Go for it. Go for it. Yeah, waiting for my turn too, you know. So give Mama David and all the others my regard.
I will.
I love you, Lily.
Thank you.
And all
Love you
Jolly
too.
Pharmacy people, Miss George and all the others. Yes, and I want to say go for it. That's my number one pharmacy from since 1970.
Oh, wow.
And I want to tell you all the best. Whatever you want to do. God gave you the ability. Go for it, my daughter.
Thank you. Thank you. And
I
Happy New
love
Year
you
to
all.
you. Love you
Tell all
too.
those at home, Darwin, and everybody hello for me.
Will do.
Nobody taking you from me. Okay, God bless us. All the pharmacies.
Thank you.
German, all the others are mine. Since I come in, I'm a very troublesome old lady. When I come in, they not just listen. Thank you very much.
Take care.
Thank you. So Leona, yes, Leona, big up for you. You get in your flowers early in the year, and that's good. That's good. That's
Appreciate
good. Flowers are to be given when people can enjoy them. So I appreciate that for Leona. I'm looking at a second development as it relates to news in 2025. That related to pharmacy. And Leona, this is one I have wanted to ask you about for a bit. I will read the news item and then you will let me know what impact that has had in Dominica as it relates to pharmaceuticals, Jolly's Pharmacy and pharmaceutical dispensation. So in September 2025, the U.S. Food and Drug Administration, the FDA, initiated a process for a safety label change for acetaminophen products and issued a notice to physicians. And this notice indicated that while no causal link was established, some studies have shown an association between prenatal acetaminophen exposure and an increased risk of neurological conditions in children, such as autism, spectrum disorder, and attention deficit hyperactivity disorder. Of course, we know from that news piece that the President of the United States, Donald Trump, had come out at the time and said, don't use pregnant women, don't use Tylenol, don't use acetaminophen, of course, brand name Tylenol, and was very direct in this news, and it sent shockwaves across the nation because the way it was delivered. Do not use Tylenol if you are pregnant. So Leona, what has this meant in Dominica? Has there been a reaction in the pharmacy as it relates to Tylenol or acetaminophen dispensation, or people having questions, queries? Of course, in America, there was a lot of there were many major medical organizations that opposed what the FDA was now saying. So the American College of Obstetricians and Gynecologists, the American Academy of Pediatrics, everybody, those big organizations were reaffirming that acetaminophen is safe for use during pregnancy. But from the Dominican perspective, what happened?
From the Dominican perspective, I think acetaminophen or Tylenol, paracetamol is still a household favorite.
Okay.
Didn't see too much of persons having any negative effect to it. And like the clip says, it's more of, there's not a lot of actual evidence to back it up. So essentially, what would have been identified was mainly in observational studies, where there's not, for instance, observational studies. You look at it, and maybe there was one or two, children born with, I'm not sure the exact numbers, with these effects. However, there's a lot of other things to take into consideration when we're looking at these things. So there could be a lot of other what you call confounding factors. So essentially, a confounding factor is something that makes it seem like, let's say, this paracetamol may be related to these neural defects or what, the birth defects, but doesn't necessarily have a direct association. For instance, paracetamol, the main use for that would be for pain or fever.
Right.
So imagine if a pregnant woman had a fever, and she used paracetamol. Now we're saying that the paracetamol, she had a child, and her child had some form of birth defect, and we're saying the use of paracetamol during that pregnancy caused that birth defect. There's not enough studies to weigh that. There's not enough studies to prove that. What it could have been is the fever, and that high temperature that she had could have caused some form of birth defect or effect
Or
on the child.
neurological disorder.
Right. So now you have that little triangle there where the paracetamol and the birth defect probably don't have any direct relation. However, the paracetamol is related to that fever, and that fever could have been, the high fever, body temperature, and your body systems are working differently at this time. Could have been what, exposed the child to some form of developmental or birth delay, So it's not too much of actual evidence when we talk about studies and enough when you talk about studies to say indefinitely that acetaminophen has that detrimental effect. It's still the safest drug of choice when we talk about pain and fever in pregnant women.
Okay. Yes. And that is a lot. That is what came out a lot from, as I said, those who opposed the label change announcement by the Food and Drug Administration, FDA, and by the President of America, Donald Trump. A lot of people, said that the safety of that drug was still unmatched, as it related to treating fevers and so on during pregnancy. So I just wondered how Dominicans, took the announcement. I know a lot of times we are affected by the American media.
Especially because it was highly endorsed,
Yeah.
all the way up
At
there,
the highest level,
right? At the
yeah.
highest level. So at that point, it's something that would definitely warrant some fear. But if you go into researching and reading a bit more, you cannot indefinitely say this. Maybe a bit more studies need to be done with the or investigating the direct relation and go on to see if it is a causative agent.
If there's causation and it's not just correlation.
Right.
Yes. Let's take a call. Caller, good morning.
It's me again. Let me say something. A question I want to ask you. When I used to be an asthmatic at the hospital for many years, they called me an unknown asthmatic. But I always learned that you cannot really use ibuprofen and all those other things there, but more paracetamol you could use. But I'm over that. I get over that the thing. But I still believe to myself. I use a little paracetamol off and on. I know it's an anti-inflammatory tablet too for inflammation and certain. But I want to ask: can people still use ibuprofen? So if you cannot use a thing, you're an asthmatic, because people don't understand sometimes they take tablets for this and this. But I know that paracetamol is very mild. I still don't study medical because I wanted to be a nurse. I didn't make it. But I'm still studying medical, and I know little that I know, Ventolin and many others I know. So I would like you to explain that if you're asthmatic, what people should more be using the painkillers.
Okay, so when we talk about asthma, we're talking about the constriction or that tightening of the bronchioles, or the tubing that's in your airways, right? So I want to break it down as much as I can. So these tighten, and when these tighten, naturally you can't get that much air in there as you normally would. And remember, the air that we're breathing in is not just oxygen, it's not pure oxygen. So imagine getting less air, so you're getting indefinitely less oxygen, and then that's what causes, that wheezing sound when all this tightness is there. So when we talk about drugs like ibuprofen, the type of drug that ibuprofen is, it's an NSAID, and I know we must have heard something like NSAID before, but you might not know what it is. So it's a non-steroidal anti-inflammatory drug. So that means it works on inflammation, but it's not a steroid. So it helps with swelling, inflammation, these kind of things. You get some form of trauma, and then you have that heat, redness, swelling. That's what we're dealing with. So paracetamol, on the other hand, doesn't do as much for those conditions. Paracetamol, you have pain, will help. You have fever, it will help, definitely. But if you have a lot of swelling, it doesn't do as much for the inflammation part of it. And so, they might opt to give you something like ibuprofen or diclofenac. Now, the problem with ibuprofen specifically and asthma is that the way that ibuprofen works, it may make that bronchoconstriction worse. So essentially, it might worsen that tightening of your chest. It might worsen, that difficulty in the lungs and the breathing. And naturally, we don't want that. So it's safer to take something like ibuprofen if you're dealing with pain on top of having asthma. If you do have an asthma attack, definitely stay away from NSAIDs if you have any form of pain or you need any relief from otherwise. However, if you're asthmatic and it's controlled, we still kind of warrant that you don't, use the NSAIDs as much, just so as you don't get a flare up especially if you don't know how that works with your particular body and your condition. So doctors will tend to tell you to stay away from ibuprofen because it can make your asthma condition worse.
Mhm. So you're saying, I think there was a little mix up. So you're saying if the person is an asthmatic
Mhm.
and they have pain, what is the recommended painkiller?
Right. So paracetamol would probably
Right.
be more first line
Okay.
for that particular thing.
Okay. So paracetamol instead of the NSAID like ibuprofen.
Yes, and
Right?
ibuprofen, to be specific, has that effect.
So okay, so that's a good one, and of course, so many of these over-the-counter medications are important to discuss because it's people use things sometimes based on what somebody else said
Definitely
works
that.
for them. Oh, ibuprofen is good for pain. That is the best pain, but then the person has asthma or the person has something else that's contraindicated. So it's always good to get the real information about these over-the-counter medications.
And just in case we don't know, ibuprofen, Advil is the same thing. Advil is just the brand name. So it's important to know what's in your medication, your brands, so that you know what you can and cannot take.
Okay. Ibuprofen and Advil. Interestingly, I am another thing that was learned about ibuprofen recently for me is the blood pressure impact of ibuprofen, because I was a very big fan of ibuprofen. And then I think on one of these shows that we had, Jacinta, I believe, was on, and we discussed that as one of the outcomes as well in terms of blood pressure. So it's important to know about your different go-to over-the-counter medications, painkillers in particular, and based on what you may have, what is best suited for you. There's one more piece of news that I am going to tease before we move on to our next segment. But we've been seeing a lot in of course herbal remedies, herbal supplements, and a lot of recommendations. I think in any one day I get about 10 different recommendations for a herbal supplement for something or the other. And of course, there are a lot of usages for a lot of what what is recommended, but there is something I just want to tease a bit, that there was a breaking story, or a story that came up in 2025, and it was linking certain liver issues to overuse of certain herbal supplements, and so it was saying that people were sharing certain stories relating to liver damage, and the feedback was herbal supplement related, and particularly herbal supplement use without consideration for other things being taken simultaneously. So the doctors, maybe you are prescribing something and the patient is already taking a multitude of different herbal supplements, and so the liver experiencing some pressure there as the body's detoxifier to do all of that work. So I saw this article come up in 2025, and it related, as I said, to herbal supplements and also to bodybuilding supplements, supplements people use for weight loss as well, and the impact on the liver. So I'm not going to read the whole thing, but Leona, any comment on supplements and liver impacts?
Right. So I'll tell you what. The liver is the body's natural detox system. So, you'll see detox stuff, but your liver, so long as it's functioning properly, is your body's natural
Yeah.
detox system. And I think we, in that situation where you have the person who's doing the most and they're kind of underlooked, that's the liver. So your liver is this organ in your abdomen that is working all day, all night to clear your body of toxic waste. It's also very important when we talk about breaking down the things that we eat or breaking down our medication. So that's the area in which this happens. So imagine that this liver is doing a big job, a lot of work, right? Now with herbal supplements, just like and I can say this for both herbal supplements as well as pharmaceutical medications, it's a matter of balance. Too much of anything is an issue, Even something as safe as paracetamol does have a toxicity level, whereas you can't meet it that easily. It's pretty high, but too much of any substance can cause effects. And so what happens is when you take certain herbal medications, some of us, we like to certain, we might have a grass, we might have and we
Mhm.
just boiling all of them together. It's not that natural means completely safe in terms of the amounts, or it's not that natural means it will not affect a body system such as your liver, right? So some of these medications, when those herbal supplements are broken down, they can have toxic metabolites, or what it is, it's broken down from this particular drug and it breaks down in the liver, and what it breaks down to could be a toxic substance essentially. Right? And if that is allowed in high doses within the body, then the liver might not be as effective in clearing it out. And so those toxins stay into the body, and then you can have, something as simple as maybe some elevated liver enzymes. You do a lab or something like that, and you might not necessarily be feeling unwell right away, but you do a lab and your liver enzymes are all elevated, and we're wondering what's going on. These are one of the things that can cause that. Or, you can have acute liver failure. So it goes from you don't have any underlying thing, but you just happen to drop down into the area of liver failure. And then when we most likely do a history, then you realize, oh, this person has been taking maybe this herb, and then they've been taking it concurrently with this drug, all putting too much weight on the liver. So it's not that herbal supplements are bad, but it's important to know how they work. And that is what we are here for, to give more insight on that. So with the herbal supplements, you don't need a prescription for most of them like you would need for a pharmaceutical prescribed medication. But so you can find it on the floor. But it's important to, before we pick up any drug, that we talk to our doctor about it, talk to the pharmacist about it, ask the floor attendant questions about it that she can then relay to who she needs to relay to, these kind of things, how it works. So depending on the drug, depending on the herbal supplement, they can also have interactions with each other that can cause a strain on the liver. So sometimes you might take something by itself and you might not necessarily get that interaction. However, with this medication or this other herbal supplement, you can get those toxic liver effects. And of course, it depends on the individual. If it is that you're a person who has kidney failure or chronic kidney disease, your body again is releasing waste in a way that is not as efficient as somebody who doesn't have these issues. And so taking amounts that, let's say, I would take without any chronic liver disease or chronic kidney disease, and you have chronic kidney disease and you take these amounts, you can then further damage your kidney. You can then now have liver failure, so they kind of lean on each other quite a bit. So it's also knowing your particular situation, your genetics, your bodily systems and how they function, your drugs that you're taking, as well as your environments too, for different things.
So just, a word of caution, this particular piece came up, and as Leona said, it is just important to be moderate and to discuss with your healthcare provider as well what it is that you're taking. Interactions might be harmful to you. Overdosing might be harmful to you as well. We're going to take a quick break. When we come back, though, we want to hear from you, our listeners. I see we have quite a few people on the Facebook page of Q95 FM and the YouTube channel. We're going to ask you, what do you want to hear in 2026 from the Health Vibes team? What topics are burning in your minds that, you would like us to get somebody on here to discuss? You would really like us to delve into that particular topic in this new year. So when we come back, we're going to be taking your calls and taking your suggestions for Health Vibes 2026. We'll be right back.
Johnny's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-hosts pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in health.
Oh, and if the convenience can make a big difference, then you can trust me. I know just where you should be. That is JP Mega, 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 Mega. The one-stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun. Shop if you're not with your social. It's to everyone. What a happy place, happy place. Oh, JP Mega, 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 Mega. The one-stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun. Shop if you're it's to everyone. What a happy place, happy place. Oh, what a happy place. But just fix some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongolia where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
And we are back with you as I promised. Now is your time. We have about 15 to 20 minutes left on the program. We want to hear from you, the people who listen to the program, as to what it is you'd like us to talk about in 2026. I see we have a caller. Let's take this call and get your suggestions flowing. Caller, good morning.
It's me that's still there.
Mm-hmm.
I learning and I giving. I want to say good morning to Miss Didi, Miss Dover, Edgar, what is the name? The delicious one. You forget his name. And all the past pharmacists. Mr. Lando, even though you're not there, but good morning, Mr. Lando. Past pharmacy. Well done, Diane. All the past pharmacists, I want to say thank you. They have been a help to me. But what I want you to discuss is that I am always conscious of that sometimes we discuss the physical so much, but we leave the spiritual side out. Because 3 John chapter 1 2 said, I wish above all things that will be of good health, even as your soul prospereth. So there is the other side there. While you're prospering, your soul is important there because that is number one in it. Your soul, you read the Bible, you meditate, you do what you have to do, your relationship with God. And the second part is that then your physicals come in there. So most times you meet goods coming in and flowers, and that same portion of scripture is in it. So when I listen to many things, sometimes it helps me to know the spiritual side is left outside because spirit and the physical and the spiritual and the emotional and the social, all this come as a part of person. So I just want a little bit of either. What do you all think? Okay. And Happy New Year to all my old families and present and everybody at Journey from North, South, East, and West. Thank you very much.
Thank you. Okay, so a suggestion there for focus on spiritual health, which is something that we've done in the past on the program, and we can definitely, revisit. We've had pastors on this program. We've spoken on this program before about spiritual wellness, about forgiveness, about dealing with grief, about prayer, and so we've had quite a few over the past year. Because of course the program has been on for a long time, and we have covered quite a bit. But in 2025, I believe earlier in the year, we did have something, but we can do spiritual health, because that's a good point from the caller. It's important as well as we speak to overall health. So psychological, emotional, spiritual, all these components that factor into to health and not just physical. So I have that noted. And of course, we're opening up the lines. We've opened up the lines to you, our listeners. If you have suggestions or interests that you think that the Health Vibes team can cover in 2026, now is your opportunity to let us know. I see the people on the social media platform also, chiming in with their comments. So feel free to drop us a line and let us know what you'd be interested in hearing in this new year. If you've heard something already that we've done, but you want to repeat, you can let us know as well that you want to hear more about this. Leona, we have a question which is coming in from the YouTube channel of Q95, and the listener is asking about pain medication, asking about if they're allergic to aspirin, what can they use? They're indicating here that a lot of painkillers have aspirin in it. So are there any non-aspirin related painkillers that they can use? So the painkiller question is back up.
Okay, so first thing, if you're allergic to aspirin, well, first thing to debunk. So, in terms of painkillers and aspirin, you will find painkillers, you'll find plain aspirin, or you might find some combination painkillers that have aspirin in it. Like, we have the QC headache relief, those things that have aspirin in them. But most painkillers, I would not say are aspirin containing. So, what it is sometimes is that the class of drug that aspirin is a part of, or is similar to, I should say, it can work similarly to the NSAIDs, and so you might have an allergy with one of the NSAIDs as well. So these are things that you might want to stay away from if you have an aspirin allergy from the NSAIDs like ibuprofen or diclofenac. Now, it doesn't have to mean that you definitely have an allergy to something that's similar, but could. So we'll definitely have to watch if you do. Now, when we talk about pain, there's different types of pain, and that's something that I really want us to take away from today. There's different types of pain, so there's different drugs to work for different types of pain and in different areas of the body as well. So if we're dealing with any form of let's say inflammation, and it is that maybe you're allergic to aspirin, maybe you're allergic to any of the NSAIDs, then there is other forms we can use. So for instance, oral ingestion of NSAIDs may cause some form of allergy, but you may be able to use a topical or local form where the pain or inflammation is felt.
Okay, let's take a call. We'll get back to that response, Leona. Caller, good morning.
Hello, good morning. Me again, Trudy. I have 3 topics here. Nutrition. If you can get a nutritionist, anything on nutrition. I think in the year we had a little thing about nutrition and what you should eat, but probably you can take another aspect of it, anything to do with nutrition.
Okay.
Then I have anger management, and then to bring back mental health again.
Okay.
Thank you.
Okay, thank you so much for those suggestions. So mental health always comes up, and we definitely need to do more. And nutrition, that's good as well. We've tried different aspects, but there's so many more aspects that we can discuss. I'm seeing one of our Facebook viewers is saying your food is your medicine. So instead of prescribing drugs, we want topics on the different foods that are good for different conditions instead of drugs. Okay. So food related, I would say medical, food related cures or food related health needs. Okay. So we have that noted. We have a call. Caller, good morning.
Yes, good morning. I always have a headache, but I always take paracetamol or diclofenac, but it's not helping. And it's a headache I constantly have. So I just probably need to know what I do. I just always check Jolly's health, my health at Fonkoli Health Center, or I go at Jolly's in Fonkoli Medical School. They take my pressure and my sugar, but I want to. Paracetamol, they do nothing. Sometimes I take 3 paracetamol, still they do nothing. But always in the night about after 10, 11, 3 o'clock in the morning. So I'm listening. You will tell me. My name is Alice Reed of Fonkoli.
Okay, thank you. Thank you, caller. So more pain related. I suspect I need to note down pain relief as one of our topics for 2026 on a show. But yeah, headache. I mean, Leona, you can comment. But I feel seeking a medical opinion on that constant headache is definitely necessary.
Definitely. If we're
Mhm.
talking about a headache that is
Consistent,
constant,
yeah. Mhm.
it's always there, or it goes and it comes back every morning. You wake up with a headache. You know, if it is that you lay down and every time you lay down you have a headache, that is definitely something that requires more medical attention. So you should probably book an appointment with your doctor. You know,
Mhm.
there's a lot of things that could be causing headache. It could be milder things. It could be more serious things. You know, the other day we spoke about the eyes.
Mhm.
We spoke about, so, you know, these are things that can also precipitate headaches. If you have sinus issues, so you're having a lot of congestion, and if you're like me, for December, it's the season for that too, with the weather and so on. So if you're having a lot of sinus congestion, you can have headaches. If you're not drinking enough water, you can
Mhm.
have headaches.
Mhm.
If you're drinking too much sugar, you can have headaches. So it's so many different things that can cause a headache. But if it's not aided by, you know, you said you're taking paracetamol and it's still there, nothing is happening, and you mentioned a certain time of the night, all of that too. It could be different things that's happening while you're laying down, while your body's at rest. Definitely book an appointment and get some
Mhm.
tests and so done.
Yeah, headaches are very, there's so many different causations. And so if you've already evaluated blood pressure, blood sugar, you might need a further, medical intervention to figure out what's going on. Maybe some tests also to be recommended.
Mhm.
Leona, you mentioned vision, dental. There are dental causations for headaches as well.
Indeed,
Some
lack
people,
of
for
sleep, so
instance,
many things, you
some
know.
people, for instance, clench their teeth during sleep, and that
Yes.
causes headache. So there are a lot of different things, TMJ disorders. So let's take another call.
Trudy,
Yes.
I was thinking of the aspect. It's not really mental, although it has something to do with your health.
Mhm.
Money, how to use, that's an aspect of money. Either how to use money, how to
Mhm.
save money. Because truly, if you haven't got money, sometimes you get in a headache.
Of course.
Some people cannot sleep, truly. You understand? They maybe spend too much there, or they have to pay. You understand what I'm saying? Trudy?
Right.
And that affects you, It
Mhm.
affects some people. So I don't know if you can take an aspect from that. Some aspect from money.
Mhm.
Fix it up, whether it's how to use it, how to spend it, how to save or whatever. You understand?
Yes.
And you bring in that part, it can affect your health. Thank you.
That is really true. No, we're laughing, but it is so true. And also, money is becoming. Well, yes, the caller is right as it relates to your whole psychological health. The absence of money or the absence of sufficient money can have major impacts on you. But as well, when it comes to budgeting and financing for health in and of itself, a lot of people get stressed when they enter a medical emergency, a medical situation, and they are not adequately prepared to finance that. That in itself causes, a lot of, and can cause negative health outcomes. So you need an emergency surgery, you need some emergency treatment, or your spouse, your child has an accident and there is an emergent medical need, and the finances are not aligned, insurance is not in place, and so on and so forth. So we can consider
Definitely. And when it comes to pharmacy too, we talk about money all the time.
Mm.
Because when we come to medications, there's brands, there's generics,
Uh-huh.
there's ways that we can help you, get the treatment that you need, but within the parameters that you can afford. So
Uh-huh.
sometimes these are things that we definitely have to talk about. We call doctors all the time. When it comes to antibiotics, to get something effective that the customer can then afford. So it's definitely important.
So we'll do a money topic. We'll frame it correctly, and we'll get a money manager on board, and we'll do a money topic. Yes, we have a call. Caller, good morning.
Not money alone.
Uh-huh.
Happy for when you feel getting rich.
Mm-hmm.
After that, this is headache,
Mm.
When you reach, especially if you see the high blood pressure.
Mm-hmm.
When they reach,
Yeah, so anger.
Yeah.
Mm-hmm,
Because they almost get mad. Just live with them if I had it for days.
Okay.
And I think that consume too much meat. too much meat or alcohol. Anything that's cause that.
Diet and alcohol. Okay. Yeah, so we're getting some ideas here. We're getting some ideas. Yes, caller. Anything else on your mind for 2026? No, he's gone. He's gone. I'm seeing some comments coming through. Leona, you will continue addressing the question in 1 minute about any non-aspirin related pain relievers available at Jolly's, and the listener is specifically saying for menstruation because Leona, you did say the type of pain is important in considering what it is that you use. I see another suggestion here. When you're taking on problems and have a lot of stress, you can get headaches and even become sick. Okay, we need a topic on stress management. Okay, so stress management is also suggested here. Boy, I remember trying to organize a topic on related around stress management and work-life balance, and we didn't get someone to come in, well, the person that I wanted to come in on that topic. So we'll try again. Stress management, and as I said, we've also kind of teased work-life balance, so the stress of work and fulfilling certain career obligations, but also of your life, your home life, and how to balance those two, so we can possibly get that on. But yes, Leona, let's take that question, the end of your response to the question on non-aspirin related painkillers.
Okay, so before I go into the menstruation, I'll just continue where I left off. So basically, there's topical options of painkillers. If it is something that is superficial, so you have some muscle pain or whatnot, then these are things that we can use. When we talk about things like sports injuries or gym injuries, exercise injuries, or again, muscle pain, we can also use things like heat and cold. So these are, some of the non-medication options that you can do. So, with ice packs or heat therapy. And heat therapy works really well as well for persons who may be having cramping, so menstruation. Now, in terms of different types of medications, there are different classes that don't work like the NSAIDs. So if you have an allergy, they can be used. The opioids are one, but these are medications that can be highly addictive. And so it's only prescribed by specific doctors, and naturally, unless you're going through chronic pain, most times are very short-term courses to avoid that negative addiction effect, right? So there's also medications that can be used, and then we're going to menstruation. So if you're talking about spasms, most times in menstruation, you have a lot of deep abdominal pain, you might have cramping, you might have cramping in the abdomen as well as the uterus. So you're feeling it in your stomach and you're also feeling it, down there. So there's medications like muscle relaxants that can be effective. There's medications like Baralgene for those who have chronic menstruation pain. I'm sure at some point you probably came across Baralgene. And the way it works is to address the spasms that's giving you that deep cramping pain. So that is one of the medications that you can ask about the next time you come to the pharmacy. Let's see if that's the right fit for you for that particular condition.
That's Baralgene?
Baralgene, yes.
It's over the counter?
It isn't over the counter. You can get it on the shelf.
Okay.
But you can come in and
ask a
discuss
pharmacist?
with us,
Okay.
about it. And we can tailor to see if that is best for you.
Okay, I've never seen that particular drug. What about Midol, Leona, that brand Midol, which is prescribed often for menstrual pain? Is it aspirin inclusive? I know back in the day, Midol and menstruation would go hand in hand when you talk about pain relief. And I have seen Midol on the shelf at Jolly's. So I'm just wondering if that's an option.
Depending. So sometimes you might see a brand name like, the Midol, or you might see, let's say, Cetamol, and some of them may have aspirin within it.
Okay.
As to exactly which one we have, I would have to cross-check.
You'd have to check,
Yes,
okay.
but some of them may have aspirin in it, but some products, their preparations are tailored differently. So you might have one without aspirin that may be effective. So it's worth asking.
Okay, all right. So to the person who is asking here about the pain relief of non-aspirin pain reliever or pain medication available at Jolly's, you can come in, do a consult with a pharmacist. Leona has given some suggestions that you can ask a pharmacist about, but I'm sure that there can be something that Jolly's has that can work
Right.
for you.
You can also ask about Cetamol menstrual as well. It does not have aspirin in there. It has some other preparations that might be pretty effective against pain when menstruation is involved.
Okay. Let's see. We're getting some topics coming in through our Facebook, Q95 FM's Facebook page. Mental health. So that's a big one. Everybody's suggesting blood pressure and stress and diabetes. Of course, we've hit the chronic diseases, hypertension and diabetes type 2 quite a bit on the program, but because they're so common and the prevalence is so high in our population, of course we will be continuing with shows on hypertension and on diabetes. That's a must on Health Vibe. So thank you, Julie, for those suggestions. We have noted them. Someone else is saying that we should bring a counselor on the show. We need some serious counseling, especially in the Trump time. I do agree. The person is also suggesting we ask Mr. Holmes so we can reach out. We've had him not in 2025, but prior to that on the show. So it might be an opportunity to revisit that. We've also had quite a few psychologists on the show in the past, and so we'll see. But I'm seeing mental health high on the agenda, and the listener is so right. I mean, it's unprecedented times in terms of the amount of negative news that we are dealing with on a consistent basis. So we definitely need to focus on mental health here on Health Vibes. No mental health, no health. No physical health, no health. No social well-being and psychological well-being, psychosocial well-being, no health. So all of these things are big factors in overall health. All right. So it is 11:32 a.m. We are at the end of our time. Leona, before we close, you wanted to...
Oh, there's one pretty big one that I didn't mention. So in terms of Buscopan as well, or hyoscine, or even there's a combination of Buscopan and paracetamol. So again, that has to be prescribed, but you can always ask your doctor about it. And for persons who may have really heavy bleeding, so that's the issue, there are drugs like tranexamic acid that can help with the bleeding that need to be prescribed as well.
Okay, so those are prescription. Yeah, so Leona is coming back with more recommendations. More recommendations for menstruation-related drug options available at the pharmacy. So seek some pharmacist consult at Jolly's and you'll get what you need. That's to the listener who asked about pain relief for menstruation pain. Yes, so 11:33 now, and we're wrapping up. This was the first show of 2026, and we hope, as we said, to bring you continuously topics that are important for managing your health, for optimizing health, topics that can lead you to think, to learn something as well, and hopefully to spread what you learn to others. And that's how we can all become a healthier society, keep the information circulating, and so we can all do better by our health. So all your suggestions have been noted, and we are aiming to bring you a Vibes year on Health Vibes. So until next week, when God willing, we'll be back on the program on Wednesday as usual, bringing you this program. We are signing off and saying goodbye, and we wish you a healthy week, a focused week, a stress-free week as well. Until we join you again next week, take care and goodbye.
Happy New Year!
Bye-bye.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your host, Trudy Kristen, and co-host pharmacist Jacinta Fagan. And